Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Rishika Barwana. The World Health Organization has now said that there is only one strain of the COVID-19 variant, the Delta variant or the B1617.2, which was first found in India. That is now a variant of concern. The World Health Organization, in its weekly review, has downgraded the status of all other variants, including the B117, which was the Alpha variant found first in the UK. Now, a latest study that was done by government agencies here in India shows that it is this B1617 variant of the virus that caused India's explosive second wave of COVID-19. According to the government data, this variant is 50% more transmissible than the B117 or the Alpha variant, which was first found in the UK. Now, the study also shows that it can cause breakthrough infections. What does this mean? It means that you can potentially get infected with COVID-19 despite vaccine-induced or natural antibodies. Now, this is the dominant variant in India right now. So, as cases decline, we will look at what India can do to contain the spread of this variant. Would it be a wise strategy for us to unlock our states? Well, joining us on the broadcast to answer some of these questions and to break down what this means, we have Dr. Monica Gandhi, infectious disease expert, University of California. She's joining us from San Francisco. Thanks so much for speaking with NDTV. The World Health Organization has said that there's only one strain or the Delta variant found in India, which remains a variant of concern. This, according to WHO. What does this mean?
So what this means, this used to be called B1617, now it's the Delta variant. Essentially, when we look at why it's of concern, it looks like it gives higher transmissibility, meaning it's more easily spread from person to person because of higher viral loads in the nose. That makes it of concern. The good thing is that it doesn't seem like it's more virulent. When we have more cases, we are going to have more severe disease, but it doesn't seem like once you get it, you get more sick. And importantly, it does not evade our current vaccines. What I mean is that if we look at the Indian Nepalese main vaccines, Covaxin and Covishield, they have both studied their vaccines against the Delta variant, and they still retain activity. Your immunity that you get from the vaccines will still work. So It's a matter of getting vaccines out faster.
All right, Dr. Gandhi, there's only one variant currently, the B1617.2 or the Delta variant, which was first found here in India, which is the variant of concern. All the other variants have been downgraded by the World Health Organization. What does this mean and how does a variant get downgraded?
Yes, you're right that there's something arbitrary about what decides about a variant of concern. The first one was the Kent variant, B117. And then everything got downgraded with time. Why? Because with time, we have seen that the vaccines get all of these variants. And in each setting where there was of concern, cases decreased eventually. Only cases are increasing with this particular variant. So it's going to still remain one of concern until cases start decreasing, until we can get more vaccine out. And then it will also be downgraded. You're right that none of these variants, in a way, are of ultimate concern because they do not break through our vaccines. And that's the most important thing about any variant. We never want a variant that our vaccines don't work against. It's a matter of getting vaccines out quickly.
Well, I'm glad that you talk about getting vaccines out quickly because India currently is playing catch up in ensuring that there's a steady supply of vaccine doses. But having said that, India's positivity rate is below 10% for 11 straight days now, and we are thinking of gradually reopening states. But with this variant of concern still around in India, now by the government's own admission, it is the dominant variant. How should we deal with unlock?
So this is exactly what happened in the UK and in the United States with this one that used to be a variant of concern, the Alpha B117. What happened is when you opened up, then cases went up further. You're right that cases and test positivity rate has gone down because of the lockdowns. So the only way to combat that is to get vaccines out faster, meaning if you're going to open up, vaccines need to be gone out faster. And you're right. There's not equity in India. We need more vaccines in India. There's not just the strategy of the government, but it is also a world responsibility to get donations and vaccines faster to areas of the world that are suffering. So I see it as a dual responsibility, not just of India, but of the world.
Well, the government, by its own admission, has said that breakthrough infections could be a possibility with this variant of concern. But speaking of vaccine efficacy, Dr. Gandhi, how long does vaccine immunity last? People who were vaccinated a while ago, say 6 months ago, are they still protected?
So the data that we've seen recently shows that likely your immunity to vaccines is actually going to be very long lasting. And what I mean by that is many of us think you're not going to need a booster for 10 years or longer. Why? Because there's been some studies that essentially show after vaccines that you produce what are called memory cells. There was a study that they gave people vaccines and they actually biopsied their lymph nodes, which is where memory cells reside. Memory cells last for a very long time. They can last for 10 years, 30 years longer. And if they see the virus again, they produce and they come out and they fight that virus. There's both memory T cells that are produced and what are called memory B cells. B cells are the ones that will eventually produce antibodies if we see it again. This is just data that's coming out really over the last 2 months that show us that we're very hopeful immunity is going to be long-lasting to the vaccines.
And these memory cells last even in non-mRNA vaccines?
Yes, it's a very good question. So though they haven't done studies with the AstraZeneca or the Covaxin, there have been studies. There was just one published now a week ago that looked at natural infection and the production of memory B cells. They actually biopsied bone marrows of people who had had natural infection and showed that these memory B cells last.
Right.
Now, natural infection is mimicking what we see with all of the vaccines, even the whole inactivated virus, which is the Covaxin, even the adenovirus with DNA, which is the AstraZeneca. So I am very hopeful that it's not something restricted to the mRNA vaccines, but that it has to do with our process of how immunity works. So I am hopeful that it will last a while.
All right. And we pin a lot of hope on the fact that you're hopeful. One sincerely hopes that vaccine immunity lasts long and, in fact, is key to, of course, fighting these new variants of the coronavirus. Thanks so much, Dr. Gandhi, for sparing your time and being with us on NDTV. All right, let's now shift our focus to the other big development that we're tracking. Now, cases in India are declining. There have been 1.3 lakh cases that have been reported in the last 24 hours. But the worrying story emerging is that the number of daily tests that are being conducted is below the target that was set by the government 2 weeks ago. So the current testing in India, averaging still 20 lakhs in the last 7 days, and these are by the government's official data, it is still falling short of what the government had targeted. Now, the government had announced that it's going to be ramping up testing to 25 lakh tests a day by the end of May and 45 lakh tests a day by the end of June. As of today, India is conducting about 20% fewer tests than what it had originally targeted. And the current trend, if you look at the current trend, it shows that India is going to fall very short of even the 45 lakh tests a day target by the month end. Remember, today is the 4th of June. In the last 24 hours, there have been an average of about 20 lakh tests that have been conducted. So how will this impact our fight against COVID-19 if India is to miss its testing target? Let's go across to the experts and we'll try and get you a point of view both from here in the national capital and also try and get you a point of view of what's happening elsewhere in the country, especially in the rural pockets. Dr. Arjun Dang, the CEO of Dr. Dang's lab, joins us. We have Dr. Shankar Haripriya, Director of the RDG Super Speciality Hospital from Ujjain with us, and Dr. Raghav Sharma, HOD Cardiology, the Meditrina Hospital, joining us from Ambala. Let me first begin by asking you, Dr. Arjun Dang, how worried should we be about the fact that the government is currently missing its own set target in terms of the daily tests that India should be conducting, and we're missing that target by about 20%?
Sure. Rishika, very, very relevant question. And especially if you remember last March when WHO had said that test and test. I think the government has done a phenomenal job in ramping up not only the infrastructure, but the testing capabilities of the nation. But currently, I would say there is absolutely no time, or this is not a situation to be complacent. Along with the infrastructure and the systems that are in place, what I would actually like to convey to the audience watching this show today is that it is also the responsibility of the citizens of the nation to come forward and test whenever there is any kind of symptom that mimics an influenza-like illness or any kind of COVID symptom. Because it's very easy to have systems and labs in place, but until and unless the people themselves come forward when they have symptoms or have had definite exposure to someone who's tested positive, it's very difficult actually to do justice to this testing that has been promised. And certainly looking at the way things are, especially in the city of Delhi, currently we are testing about half of our capacity. And that is also because the infection rates have gone down. But certainly people need to come forward and test whenever they think that there is even a little chance that they might be infected.
Well, it's important that you say that you're testing half of your capacity, because as we move towards a gradual lifting of the COVID-19 restrictions, because obviously cases, say, in the national capital have dramatically come down, testing becomes even more important to prevent a surge in cases once again. Let me try and also understand what's happening elsewhere. Dr. Sharma joins us from a hospital in Ambala. Dr. Sharma, give us a sense of what it's like where you are. And what is it like in the rural pockets? Are we being able to reach far-flung areas and conduct the testing that needs to be done, given the kind of rural proliferation of COVID infections that we've seen in this wave?
The point is, as you have rightly mentioned, though we are doing quite under testing, there are multiple reasons for that. So one of the reasons are people themselves are also scared quite a lot with this COVID-19 issue. If we come positive, whether we will be quarantined. So they need to be counseled and explained about the disease per se itself. As far as rural population is concerned, in Haryana, what we are following a project is we are giving targets to various PHCs and CHCs to do around 150 to 200 testings per day. So roughly we have 18 labs, government labs, which are operating across Haryana, and they are doing around 25,000 tests per day. And the protocol is they do card test, and if they find that card test is negative, they do RT-PCR. If your card test is coming positive, we are considering them as positive patients. So that is the protocol we are following in Haryana as of now.
But is there reluctancy? Like you said, people are scared. If they test positive, they'll be quarantined. What is the action that will be taken? Do you believe that hesitancy or, you know, the fear of quarantine is something that is predominantly one of the reasons why there's low testing?
Yes, of course, I do feel so, because see, the problem is the population which we deal with are mostly in the rural areas and very less in the urban areas. So to explain them and convince them, and even in urban areas to talk to people, explain them, it is little difficult. And with Corona, with the first wave as well as with the second wave, if you see, it has created a lot of havoc. So there is a lot of, people are quite scared about that part also.
Right. Dr. Sharma, very quickly, I'll also ask you about the logistical challenges, and I'll bring in Dr. Dang into this conversation as well. What are some of the logistical challenges, especially when you need to reach far-flung areas, test in the remote areas? Are RT-PCR tests being done? Are they possible? Are we facing logistical challenges 1.5 years into the pandemic as well?
Yes, of course, we are facing logistical challenges. See, despite of the fact that we try to convince people, it is very difficult sometimes to make them understand why these tests are being done, what is the advantage. And it is sometimes like challenging to convince them, please come and get their test done, even if we are sending people to their house. And so I think we need to explain them, and we have to tell them there is no need to be getting panicked about it. It is for themselves.
So, Dr. Dang, if we understand this correctly, one side of the story is that there is hesitancy. People are scared to get themselves tested. They fear they'll be, you know, put into quarantine, etc. And that's to a certain sense justified as far as rural India is concerned. We've seen that even with vaccines, a lot of hesitancy. But how can we combat the logistical challenge in order to make the process of COVID-19 testing easier and therefore more widespread?
Sure. So Rishika, you are absolutely correct. There is significant hesitancy, but also at the same time, we have to put in action the learnings that we have from the first wave. Now, what exactly happened, in the second wave that we just had, what exactly happened was that labs were in place, testing was happening, but the main issue that we faced and a majority of the labs faced was the shortage of manpower. Now, when the city itself is having such a huge surge of infections, the manpower itself, the technicians who are actually going out to collect the samples, they themselves sometimes get infected. And obviously, healthcare workers being directly in the front line, there's a huge chance that there'll be a manpower shortage. So in order to combat this, I would certainly suggest that the government and the authorities and ICMR also look at other ways of testing, that is RT-PCR testing on other sample types. So if you are aware, there is a kit that was released by NDTV and has also been recently approved by ICMR. That is basically a saline gargle wash RT-PCR. So the patient or the person, what they have to do is that they have to gargle that saline and then submit that sample. So also the home test rapid antigen test kit that has recently been approved by ICMR clearly takes out the logistics factor, that is the technician actually having to go to the house and also use PP, etc. So you can certainly get rid of all that and the sample directly comes to the lab. Now, also in the West, a lot of institutes and a lot of labs have also used saliva as a very, very effective tool of processing these RT-PCR samples. And currently, we ourselves are actually in the middle of validating a study in which we are using the sample type as saliva to actually carry out these RT-PCR tests. So effective ways such as these will not only make things simpler to mitigate the effects of the next wave if it comes around.
All right, because one did see that even in the national capital, there was, paucity of availability of appointments to get yourself tested, delays in results in several labs. So one has seen that, and if that's the status that one has seen in the national capital, then one shudders to think what it's like still in several parts of rural India. But that's interesting because there are twofold challenge with testing that have been pointed out by both the doctors. One, of course, is the logistical aspect of it that needs to be addressed. We need to make testing easier. And the second, of course, is awareness about the need for testing, especially in our rural population. It's an important issue and we'll continue to keep a close watch on this story. Thank you, doctors, for sparing your valuable time and being with us on this crucial conversation. We're slipping into a very short break, but on the other side, we'll answer any questions that you may have about the COVID-19 vaccine specifically. Stay with us. Welcome back to our special campaign, Vaccinate India, in partnership with Google. We're discussing any questions you may have about the COVID-19 vaccines. We all take to Google to seek many such answers. We have an expert doctor to answer some of those questions. Dr. Arjun Dang is with us, the CEO of Dr. Dang's lab. Dr. Arjun Dang, I want to begin by asking you one of the most commonly asked questions. Are the COVID-19 vaccines effective, given the fact that some people have been reinfected with COVID after they've got the first shot of the vaccine?
So certainly this is a question that has been asked very widely, and there are certain breakthrough infections that have been reported even after the vaccine. If you look at the efficacy of any vaccine currently against the COVID-19 virus or the mutations that are there, you must understand that this vaccine won't protect you from reinfection, but certainly will protect you from any serious infections. So if you take the vaccine, your chances of actually getting hospitalized or having a serious infection goes down significantly. So you certainly should not hesitate and certainly vaccinate.
Right. So the COVID-19 vaccine is effective, at least in granting protection from severe disease. Okay. I also want to ask you about vaccine efficacy and the difference between how effective a vaccine is after one dose vis-a-vis the second dose. A lot of people have questions on whether one dose of the vaccine is enough.
No. So all vaccines should be taken as per the guidelines. The current two vaccines that are available widely, Covaxin and Covishield, both need to be taken as per both the doses in the given time period, because the maximum immune response that we have seen is only after both the doses. what has actually happened with the second wave infections is that a lot of people have this question that they've gotten infected after the first dose. So in case that happens, then is the only time that you can delay the second jab. And the current guidelines which say that you need to wait for 3 months. If you get infected, then you can certainly delay the second jab till you completely recover, and also the time duration of 3 months.
Right, because that is one of the other big questions, right? That if you have got the COVID-19 infection, say after your first jab, should you still need a second one, because there would be some amount of antibodies that you'd already have?
So the whole point of the vaccine is to increase the immunity that you already have from the infection. So the whole point of even saying 3 months is because that is the time when the immunity that you develop is at its maximum peak from the infection.
Right.
So if you take the second jab after that, it further gets boosted and you get the maximum immunity from the infection there.
All right, important clarifications there about the effectiveness of the COVID-19 vaccine and the importance of taking both the shots of the vaccine. I also want to ask you about the safety aspect associated with the COVID-19 vaccine. Dr. Dang, we are seeing people hesitant. Many people have questions on the possibility of side effects. What would you like to tell them?
So currently, all the data that we have and the many people who've even gotten vaccinated, there are no serious side effects from any of these vaccines. In certain conditions, when a person has a serious allergic reaction to the first dose or to a previous vaccine in their past, then your physician will definitely recommend that you do not take the vaccine. But apart from that, any other significant ailments that you might have, you can certainly go for the vaccine. Even immunocompromised people must more importantly go for the vaccine. And certainly there is absolutely no space for hesitancy when it comes to taking any of the vaccines that are available.
So if you're prone to allergies, should you consult a doctor before you decide to take the vaccine?
So, Rishika, it's very important to understand that people who know about their allergies currently might be to some food allergens or to some respiratory allergens that we commonly call as aeroallergens. Currently, there is no data that suggests that if you're allergic to, say, a pollen or a dust mite or something like milk or any other food item, that you would be allergic to the components of the current vaccine.
Right.
So certainly these two are not connected, and you can definitely go for the vaccine in these cases.
All right, Dr. Dang, thanks so much for joining us and issuing those important clarifications on the COVID-19 vaccination.